To summarise our programme, we really focus on developing clinical skills that people need to develop if they're thinking of moving on to a career in clinical psychology or any allied profession. So we really have a thread that runs through all 3 stages of the programme to help build those skills. So things like formulation, assessment, diagnosis, they're some of the common things. A lot of our graduates will go into charity roles, they might work in the NHS or they might work in the private sector, they might move into an occupational setting. But it's somebody who supports someone's mental health. That could be adults, it could be children, it could be older people, it could be people rehabilitating from various injuries. It's a really broad profession. The programme at Sunderland is also really integrated, so we don't silo everything into developmental or bio or cognitive psychology, but our modules all draw together those things to look at the more holistic picture, which is a brilliant way to help clinical psychology students think about how it all fits together when they're moving into practice. Clinical psychology is a very competitive career because it's such a rewarding and well-paid career. So really as early as possible, students should be thinking about how they can gain that work experience. And we provide placement opportunities throughout the 2nd and 3rd year for them to do that. But also some of the ways seminars are set up with role plays and working in multidisciplinary teams helps them to build those skills and the kind of experience they would need to evidence in job applications. We support students to gain work placement through some structured modules. So in their 2nd year, there's a core module that all students do where they can do 36 hours of placements. Some of those get advertised by academics in the department. So if students have a particular area, it's really easy for them to approach members of staff and talk about what they'd like to do. But similarly, every member of staff works externally. So we all have contacts with charities and local organisations. For students wanting to come on to clinical psychology, the most important attribute is probably being proactive and just being willing to learn. I think the most positive thing I've seen students get out of the course is the concept that we are working with patients. Students who do that will really get a lot out of the programme and being open-minded as to what they want to do when they finish.